All right, good morning, everybody. Dr. Ray Fitch here, Vet Triage. It's July 9th, almost 9 a.m. Pacific time, and let's talk about pain management in dogs. Um, the discussion will be based on kind of a general concept point of view, just like general options that are available to you. Obviously, we can't go over specific medical advice. You need to consult with either vet triage for that or your own veterinarian. But we can at least talk more generally about it to give folks some insight as far as like what the potential options are for analgesia in animals. Um, there are, of course, a number of reasons why animals would be in pain, right? But that's a different discussion. We're going to talk about you think your pet's in pain or you know they're in pain. What do you do about it? And we'll start very basic. Let's say there's a specific point on your pet's body or a movement that they are engaging in that's causing pain. Well, easy answer is you just stop moving in that way or stop touching that part. And it's one reason why we recommend pets not run, jump, play, use stairs, run around, that kind of stuff after surgery when they have an incision, because we want to not only um, help promote the healing by preventing tissue motion through that movement, but also movement causes them more pain. And if the pet's in pain, then they're not going to eat, not going to drink, they're going to be lethargic, they're going to be aggressive, they're going to hide, they're going to tremble, um, you're going to be concerned. So, restricted activity is a easy way of taking care of pain as well in some circumstances. Obviously, it's not always going to be sufficient, and but at least it is an option. Second possibility are actual analgesia, like drugs you can give at home. And so these are parental drugs, PARENTERAL, meaning they are, rather enteral, rather, meaning they're going through the intestines. You're giving it orally through the mouth. So you can give pain medication. Some pain medications are of the narcotic variety, like opioids, and are controlled substances. Others are anti-inflammatories that are not controlled substances, and there are many, many others that are available to us, but they're prescriptions, and so you have to go to a veterinarian or talk to vet triage to get them. So actual pain medication is probably the most common solution that most pet owners think of with analgesia, and I would include veterinarians in that category as well. Parental or parenteral drugs that are given injectable, so intravenous, intraosseous, intramuscular, intraperitoneal, rectally. Well, let's leave rectal out of it because some pet owners out there do give drugs up there. Injectable drugs are also an option as opposed to oral drugs. They are uh, almost always, not always, but almost always given by veterinarians in a hospital setting. And these are for cases that are needing analgesia in the immediate post-operative period, or their pain is so severe that they can't be managed with just oral drugs. They need actual injections. Whether that injection is given as a bolus, so meaning you give an injection every 4 hours or 6 hours or 8 hours or whatever, um, or whether it can be a continuous rate infusion, which is a CRI, so continuously being given IV, let's say. It's up to the doctor that's in charge of your case. But regardless, it's not something that you're going to be doing at home. You're going to be doing this at in the hospital, or they will be doing it at the hospital for your pet. Um, if you are giving an injection at home, it's probably subcutaneously, and that's between you and your veterinarian whether or not you could do that. The next form of analgesia um, is local anesthesia. So, lidocaine is the most common one, but there's others. And again, there are some permutations of local anesthesia that are only for doctors to use in the hospital. There are others that might be prescription or over the counter that are like a gel or something that have lidocaine in them or some other equivalent in them, and you can put that over the area of pain. and that can help as well. You need to always do this by the recommendation of a veterinarian. There are certain species like cats, for example, that they are very, very sensitive to the toxicities associated with local anesthesia. So don't take any of this information and just use it. You need to talk to a veterinarian. But local anesthesia is another form. Another form of anesthesia, or analgesia rather, is ice packing, cold compresses. Again, don't do this without a veterinarian directing you, but if you can numb the nerves in that area, that helps with the nerve transmission of pain. So numbing them by applying a cold pack is also a good solution. This is assuming, of course, you can catch your pet and they'll tolerate it. Not every pet will. And again, you can cause damage with this, so you need to make sure you have a veterinarian direct you on how to do this. And other forms of physical therapy besides cold compress, range of motion, massage, stretching, these things are also very good for analgesia. Again, you're going to do that under the direction of a physical therapist or a physiotherapist for animals, and they'll direct you on how to do that, whether it's appropriate or not. Not every case can handle that, and it may not be enough. And then finally, something like compression, so like placing a bandage on a pet's limb, that can help with swelling and inflammation by keeping things contained. That bandaging, again, done by a veterinarian, has its pros and cons as well. It can cause damage, so it needs to be done appropriately for the appropriate situation. But that compress can also help with pain management as well. And then finally, it's really a combination. It's often the case that, especially for severe cases of pain, that a multimodal approach / a polypharmacy approach is what's needed in order to keep these pets under control. It's often the case that not just one modality is not perfect for all cases, right? You have to tailor it to what the pet needs, and sometimes you need more than one intervention to help control pain. So that's usually what ends up happening, but not always. It depends, but that's usually what ends up happening. And yeah, I think that's probably a good place to go. I would say there are some creative over-the-counter solutions, although they are few and far between. You can talk to the triage veterinarian about those options, and they can go through some creative options for you in case you don't have access to pharmaceuticals or emergency care or whatever it is. They can help you figure out more creative solutions to take care of these pets that are in pain. So feel free. Pain, we try to get rid of pain because it can cause other downstream effects. It increases cortisol levels. It causes alterations in cardiovascular function, respiratory function. It can create a more chronic pain situation where the longer the pain goes on for, the harder it is to control. And so for all these reasons and more, just overall improvement in quality of life, you want to tackle pain, not just because, but there's actually downstream physiological and anatomical effects to it if you don't manage it appropriately. So we want to be able to tackle pain. And we're probably going through a phase right now, or at least we had been in veterinary medicine, where we were overdoing it with the analgesia. Pets were getting continuous rate infusions of morphine-like drugs for very simple procedures that did not used to need them. And so we sort of, as we frequently do, we overcorrected the pain problem in animals by really hitting them hard with drugs for situations that may be a bit overkill. Can you over-medicate a pet? For sure. We don't see addictions in animals the way we do in people, even for addictive drugs like opioids. At least we don't recognize that anyway. Maybe it happens, but we just don't recognize it. But you can overdo it. Analgesia has their own side effects to it, depending on what you're talking about, whether it's drugs or bandaging or cold compress or whatever. They all have, of course, like anything, side effects to them or downfalls to them. So you need to always do this under the direction of a veterinarian. Vettriage.com can help. And yeah, that's a pretty good place to stop. Thanks everybody for watching us on the playback. Feel free to subscribe, donate, share, do all the things. See you in the next one. Take care. Bye.